83 hospitals.
And county governments have been urged to increase investments in health services to curb preventable maternal and newborn deaths, as current efforts remain insufficient to meet the 2030 Sustainable Development Goals. Now, statistics show that Kenya loses about 5,000 women and 92 infants every year to preventable complications. Stakeholders now warn this is a crisis that can be averted. Here's Jesse Rogers with more.
Audits can happen at anyone.
For the third day, county health CECs have been meeting to deliberate on how to tackle maternal and infant deaths. Every 2 hours, the country loses a woman to maternal mortality, yet experts say 7 out of 10 of these deaths are preventable.
Why should a woman in Kajiado die? Because the ambulances there were all engaged, yet there's an idle ambulance in Machakos. And the difference between Machakos and Kajiado is a road. A mother needs an ICU bed, and there's one in, say, Kajiado, and there's a patient in Kiambu who needs that bed. Why can't we take this woman there so that she can survive?
Every 2 hours, we lose a woman in this country. And yet 70% of these deaths are preventable. So as Luala, we are on a mission to reduce maternal mortality and child mortalities as well as morbidities.
The situation is equally dire for newborns, with dozens dying at birth daily.
We need to get champions and support for these champions on the ground, because not everybody is very interested. Everybody has their own interests.
County governments are now being urged to invest more in maternal health care, partner with the private sector, and prioritize programs that directly save lives.
We have long distances to facilities. I believe if you have the CEC Isiolo, the average distance, last time I checked, from a household to a health facility is 42 kilometers. Literally, a woman who is pregnant has to walk a marathon to get services. So we are trying to sensitize our governments, and that's why we are here, to tell us we need to reduce this problem by embracing community health workers.
Health Principal Secretary Dr. Omo Luga has emphasized that investing in healthcare professionals, including doctors, midwives, nurses, and community health workers, will be crucial to improving maternal and newborn outcomes.
Just invest just a little. I know that it's a very difficult discussion sometimes in the counties because you have this ceiling around equitable share, but somehow we must make the case about the numbers for health workers, just numbers, the adequacy, because you cannot have one nurse taking care of 14 units. It's not possible.
Meanwhile, WHO reports that while global maternal mortality dropped by 40% between 2000 and 2023, the rate of progress remains too slow to meet the Sustainable Development Goal of reducing maternal mortality to less than 70 deaths per 100,000 live births by 2030. Jesse Rogers, KTN.
Thank you, Rogers, for that report.